Today, I want to take a moment to share an important initiative happening right here in our community. A collaboration that is changing lives through access to fresh, locally grown produce. Yes, even though I'm a carnivore, many of my patients are not. And I'm in the business of meeting people where they are. But before we dive into this important story, I have a question for you. What would you do to improve healthcare in the United States? Whether you're a patient, a caregiver, a frontline doc or clinician like myself, or a leader like Advocate Healthcare CEO Eugene Woods, each of us has a role to play in breaking down barriers that have prevented so many people from achieving true health and wellness. Guys, we need your help. In the comment section below, share your thoughts, your ideas, and your bold solutions. Let's inspire each other and show how we can come together to create a healthcare system that works for everyone. In the video you're about to see, you'll learn how programs like our Food Pharmacy and Smart Farm are addressing critical gaps in healthcare, helping patients on Chicago's South Side gain access to fresh, nutrient-rich food and reducing health disparities. And it's all happening because of the shared vision and commitment of a leader like Eugene Woods, who believes that health goes far beyond the walls of a hospital. And if you want to learn more about Eugene's vision, make sure to check out his book, Health, Hope, and Healing for All. I'll make sure to share a link to his book in the comments. Now let's take a look at the work we're doing here at Advocate Health.
My hope for the next generation is that they will live healthy and long. The prevalence of diabetes won't be there. The prevalence of obesity, prevalence of high blood pressure won't be there in our communities and our families.
At Advocate Health, we have that vision too, but not just for future generations. With the 12-year life expectancy gap in Milwaukee based on zip codes, and a 30-year difference in Chicago between two communities just 9 miles apart, we are committed to addressing inequities now in healthcare access and other resources many of us take for granted, like fresh, nutritious food. Just one of the social drivers of health we're addressing in our communities. Sowing seeds of change with initiatives like community gardens, pop-up farmers markets, and mobile food pantries, partnerships with food distribution and hunger relief organizations, cooking programs for school kids, and a homegrown program called the Food Farmacy, where patients are given prescriptions that get at the root causes of chronic illnesses with, well, roots.
Things like diabetes, hypertension, heart disease, stroke, and even things like dementia. People don't realize that all of these diseases are connected and that they're mostly due to poor diet. And what we found when we talked to the patients, they don't have access to the right foods in their communities. So we said, it's our responsibility to give people the food that they need.
And that's what the Food Pharmacy does. It gives people what they need to improve their lives and reverse disease, all with a box of fresh food, tasty recipes, and healthy eating education.
Very excited about seeing how you're doing.
I almost died from diabetes, but I've changed my diet and I'm healthy now. And I haven't been on any medication for 3 years now.
It's literally as effective as medicine for many patients. And so we're trying to shift the paradigm from chronic disease management to a paradigm where we actually help people reverse and heal from the diseases that they thought they'd have for the rest of their lives.
Today we have cabbages, zucchinis, we have mangoes, apples, oranges, and we have a protein today, which is a whole chicken.
Good. We used a lot of the greens, which is also a blessing because they were so expensive in the stores.
Actually, before I had Food Pharmacy, I really wasn't eating a lot of vegetables.
Where are we going to put them today?
But since I had the Food Pharmacy, I eat more fruits and vegetables, leafy greens. And then when you get the food, you get a handout with it and they tell you the benefits of it. Also give you recipes on how to prepare it. So the Food Pharmacy, it allowed me to understand the healthier foods and how I should be eating to make my health get better.
We're also thinking of fresh ways to source the food we pack into our food pharmacy boxes, sometimes looking no further than our own backyard.
I get kind of a head tilt when people hear that a hospital is, trying to expand a farm, but we are very committed to health equity, being able to grow food locally and then taking it down to our sister hospitals and supporting them with their food pharmacies to really make meaningful change for our community and patients that we're serving.
Food pharmacy changes how my household eats. Since now that we have the fruits and vegetables, it just enhances our health. My A1Cs went down, my blood pressures got better, and it may not look like it, but I have also lost a little weight.
It's lowered my cholesterol, A1C, blood pressure, hypertension, and everything has come down. My doctor's like, wow, you are doing so much better.
Simply by providing fresh foods, we're changing the health and futures of not only our patients, but their families.
I've had examples of parents tell me that their kids' grades are as high as they've ever been simply by giving them access to the food pharmacy. People have more energy, they're sleeping better, their mental clarity is better. They become better versions of themselves.
Everyone deserves to reach their full potential. And when something as simple as good food can support that, together, we share a responsibility to make good food available to all.
It's always going to be important that we have people who understand the vision, are willing to support the vision, and then walk with us as we help our patients to heal.
Thank you so much. I really appreciate it. You're welcome.
You can heal by putting the right food in your mouth. We are all responsible for sharing that message. So let's work together to create a world where everyone has access to quality food so that they'll be able to live a full life and achieve their dreams. Thank you for taking the time to watch and learn about the transformative work being done through our food pharmacy and Smart Farm programs. These initiatives show what's possible when we think outside the box to tackle health inequities, but this is just the beginning. Now I want to hear from you. How do you think we can improve healthcare in the United States? What ideas do you have to remove the barriers that prevent people from achieving their best health? Together, we can create a system that truly works for everyone. One that prioritizes prevention, addresses root causes, and ensures equitable access to care. Share your thoughts in the comments below, and let's keep this important conversation going. And don't forget to like this video and subscribe to my channel for more stories about how we can protect and elevate our health.